any myths or any misconceptions, you can call me on program Hello Dotor on 13 May between 6 to 7 p.m. I will try to clarify your doubts. I will try to clear those myths and misconceptions. So do not forget to watch the program Hello Dotor on 13 May between 6 to 7 p.m. and do call me to clear your doubts. Hi.
नमस्कार. प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळीन तुमकां सगळ्यांक म्हजो डॉक्टर स्टेसीचो माय मोगाचो येवकार. इश्टानो, दर एका सप्तकांत आमी एका नव्या दोतोराक, नव्या तज्ञांक तुमच्या फुडें हाडून तुमच्यो वेगवेगळ्यो म्हायत्यो, तुमकां तुमचे वेगवेगळे प्रश्न आमी सुटावे करता. तसोच आज म्हज्या वांगडा आसा कर्क किंवा कॅन्सर ह्या दुयेंसाचो तज्ञ, त्या भायर हिमॅटॉलॉजी किंवा रक्ताचे दुयेंसां आनी रक्ताच्या दुयेंसां विशीं म्हायती दिवपाक ताचें शिक्षण जालां. चड वेळ वगडाय नासतना आमी ताजो आयज ह्या कार्यावळींत येवकार दिया. डॉक्टर अक्षय करपे. डॉक्टर अक्षय येवकार आयच्या कार्यावळींत. ही कार्यावळ सुरू करच्या पयलीं दोतोर तुजी आमी ल्हानशी एक वळख घेवया तुज्याच उतरांनी. तूं ऑन्कॉलॉजी किंवा हिमॅटॉलॉजी हे दोनी स्ट्रीम्स तुवें कित्याक लागून चूज केले, आमकां हाजे विशीं सांगशी?
So, hello, I'm Dr. Ashay Karpe. I'm a medical oncologist and hematologist.
Right.
So, after my MD medicine, basically we had a very little exposure about blood disorders, and that is the reason why I decided to study blood disorders and then also blood cancers in 2007. And after that, actually I just met one cancer patient. He had some doubts about his cancer, but I couldn't answer because I was not knowing any other cancers except blood cancer. So then I decided to study other cancers also. So almost since 15 years I am in the field of oncology, and also I've did hematology and bone marrow transplant over the year of time. So as cancer affects people's lives most adversely, I think that is the reason why I chose this branch, because I want to help out these patients.
Right, doctor, that is a very nice thought on your part, and to study such vast subjects, medical oncology and hematology, I think it's really hats off to you. So just to get the show running, and before that I'll tell our viewers की आमची ही कार्यावळ फोन इन जावन आसा. आमचो नंबर जावन आसा 24904444 आणि 24904445. त्या भायर आमी लायव्ह आसा यूट्यूब आनी फेसबुकाचेर. थंय तुमचे प्रश्न तुमी आमकां विचारूं शकता, आनी नक्की आमी सगळे तुमच्या प्रश्नाचे जापो आमी ह्या कार्यावळीन दिवपाक आमचो हो आमी ट्राय करतली. So doctor, just to start the show, do you think cancer is hereditary? Like, if there is a familial, is there a familial trend in cancer? Are you at a high risk if any of your family members suffer from cancer?
Okay, so to give a brief about it, when I see all cancer patients, only 1 to 2% of the cancers, they are hereditary or familial, what we say, while almost 95% of the cancers, they are not hereditary. The highest chance of hereditary cancer is in the breast cancers and ovarian cancer, which are the gynecological cancer, and there are certain cancers in the male like prostate cancer. While 95% of the times it is not hereditary, but people have this stigma, in the back of mind. If somebody is affected with a cancer in the one family, whether to, I will, because one of the commonest thing question which I get is, shall we marry our daughter or marry our son in that family because their parent or somebody had a cancer in their family. So just to give a brief, only 1 to 2% of the cancers, they are familial. Overall, all cancer patients. maybe risk in the highest in the breast and ovarian cancer, but definitely consult any oncologist or specialist before you take a call whether this is hereditary or not.
Right. Doctor, smoking and tobacco chewing, does that lead to cancer always? Because most of the times in medical practice we see a lot of patients who have never ever smoked or eaten tobacco. I'll just interrupt my question. We have a call here. Hello.
Hello, madam.
Yes.
Hello, madam. उलोवपाक शकता हांव?
हय, मातशें व्हडल्यान उलय आनी तुमचो टीव्हीचो वॉल्यूम मातसो कमी दवरा.
ना, म्हजे कडेन टीव्ही लायिल्लो ना हांगा
ओके
मॅडम.
ओके, आतां आवाज येता तुजो. विचार,
हय
प्रश्न
हय
विचार.
मॅडम, म्हाका डॉक्टर आसा न्ही, विचारपाचें आसा.
हय.
म्हजो मिस्टर आसा तो HCG हॉस्पिटल बेंगलोराक ट्रिटमेंट घेतालो हाजो मॅलिग्नन्सी कळ्ळें. सो तांच्यांनी थंय IT इंजेक्शन्स दिली ताका 3 म्हयन्यांतल्यान 1 वेळा करपाची कळ्ळें न्ही. ग्रॅज्युअली ती चेंज करून विकांतल्यान 2 वेळा जाली कळ्ळें न्ही.
ओके.
इतली गॅपा वयल्यान 2 जाली कळ्ळें न्ही विकांतल्यान. आतां प्रॉब्लेम असो जाला, ही इज नॉट एबल टू बॅलन्स हिमसेल्फ वायल वॉकिंग.
ऑलरायट.
सो ताजेर उपाय कितें आसा? म्हणजे स्पायना दिताली न्ही ती IT इंजेक्शन्स.
IT इंजेक्शन्स. ओके.
हय
अजून सुद्धा घेता IT इंजेक्शन्स?
चलपाचे खूप त्रास जातात कळ्ळें न्ही.
ओके.
सो कितें ताजेर म्हणजे कितें एक्सरसायजीस घेवपाच्यो टू इम्प्रूव हिज वॉकिंग कळ्ळें न्ही. म्हणजे म्हाका ताजेर मातशी एक क्वेरी आशिल्ली डॉक्टरा विचारपाची.
ओके. डॉक्टर, you got the question?
No, I didn't get a question. Sorry.
So her husband is having malignancy. खंयचो कॅन्सर हा म्हणला तुवें?
इट स्टार्टेड विथ कोलोन.
कोलोन.
मागीर तो हातून गेलो म्हणजे इन लंग्स.
ओके.
मागीर ब्रेन. ब्रेना जातकच तांच्यांनी सजेस्ट केलें की IT इंजेक्शन दिवपाक जाय म्हयन्यांतल्यान 3 म्हयन्यांतल्यान 1 वेळा.
ओके.
ग्रॅज्युअली तो शेड्यूल चेंज जावन विकांतल्यान 2 जातकच तो जाम जावपाक लागलो कळ्ळें न्ही.
रायट.
आतां ही इज नॉट एबल टू बॅलन्स हिमसेल्फ.
ओके.
सो डॉक्टरा म्हाका क्वेरी इतली विचारपाची की वॉट इज द नेक्स्ट स्टेप so that he can balance himself. किती मेडिकेशन्स घेवपाचे, किती एक्सरसाइजीस आसात ताजेर, so that only he can balance himself while walking कळ्ळें न्ही.
बरें. आनी दोतोर तुमचो क्वेश्चनाचो आन्सर दितलो.
Yeah. So basically he is having a colon cancer, which is the cancer of the intestine, and it has spread to the various organ, including the brain. So they are giving him intrathecal injections, which are basically we give for controlling the brain disease. So right now he is having a imbalance. So most likely I think his disease has worsened over the period of time. So at this particular point of time, we would like to get a MRI brain again, repeat, and then again we see whether disease has worsened or not. So basically there are various options. There are certain drugs also which can cross the what we can cause say blood-brain barrier, and they can enter in the brain and can treat. Or sometimes also we give radiation. Again, without seeing the patient, it is very difficult to tell why exactly all this having a problem. But the next step will be to get his MRI brain done, and then we can take a call based on that.
रायट.
आनी तुमकां म्हणजे फिजिओथेरपी किंवा मसाजीस वोंट हेल्प, अशे आयुर्वेदीक मसाजीस ती दिवपाक जायची ना?
Physiotherapy would it help if he takes physiotherapy or any massage? Yeah. Is what
so
she's asking.
If there is a weakness, then physiotherapy will help that. But the underlying brain problem, unless we solve that brain problem, it is very difficult to see the impact. But yes, physiotherapy is mandatory if the patient is having any weakness. So if there is a weakness in the hands or weakness in the feet or even in the face, then physiotherapy will definitely help this patient.
Right.
The feeling, doctor?
सो दोतोरान तुमकां जशें सांगलां की ताका पयलीं MRI करून तेजो इवॅल्युएशन करून फुडें कितें जाय तें डॉक्टरूच डिसायड करतलो.
Okay.
Yes.
Thank you.
Yes. So doctor, we have another question on social media. It says, I have been diagnosed last December on an ultrasound with gallbladder polyp, which is about 6 mm, and others and today only I did it is increased to 8 mm. Is it something to worry and is it dangerous?
Yeah. So to just give a brief, all gallbladder polyps basically they are not having a malignancy. So we usually ask the patient ki how symptomatic they are. Means that we always ask ki whether any gallbladder patient when it is there, if they are requiring more 2 to 3 times in a year for that problem they have to contact their physician or surgeon, or even they require hospital admissions, then we tell them yes, this gallbladder problem is significant. Most of the times they are having a gallstones. So usually we see gallstones is almost 30 to 40% of the patients when they are cross age of 40, and in also certain blood disorders also we see. But all gallstones are not indicative of cancer. Yes, there is 1 or 2% chance can they develop a cancer. So usually what we say, usually you should have serial sonography, maybe repeat every after 3 months. If there is not much change and if there is no weight loss or no other things, usually you should not worry about it. But if you are requiring at least in a year more than 2 to 3 times to visit a doctor for the problem, then definitely that person should get evaluated for the same.
Right. Doctor, we have another call, so we'll take that. Hello?
Yeah.
हॅलो
Yes?
म्हजो प्रश्न आसा
Oi?
विचारूं
Oi, विचार.
म्हजो प्रश्न असो डॉक्टरा विचारपा जाय ब्लड कॅन्सर जाल्यार तो केस गमता म्हणजे जिवाक कितेंशें जाता आनी दुसरो प्रश्न दोळ्या कॅटरेक जायनासतना दोळ्या दिश्टी पडना आनी दोळो मातशें कितें जाला ते दोळ्या केन्ना कॅन्सर जाता हांवें केन्ना आयकोना म्हूण दोतोरान म्हाका सांगपाक जाय.
ओके. सो तुजो पयलो क्वेश्चन आहा तो ब्लड कॅन्सराचो. हाऊ वूड यू नो इफ यू हॅव ब्लड कॅन्सर? वॉट आर द सायन्स अँड सिम्पटम्स ऑफ ब्लड कॅन्सर?
Okay. So signs and symptoms of the blood cancers are basically the patient will start feeling weakness where there is no apparent reason for more than say 2 weeks. There is a significant weight loss, which we say more than 10% of the body weight. Means the patient's weight is say 60 kg and they have more than 6 to 7 kg of weight loss in the span of say 3 to 6 months, and which was not planned. If they are having easy bleeding, we can see the bleeding in the gums, we can see bleeding from the nose, bleeding in the stools, or if they are having something red patches, which is bleeding in the skin, or if there is a joint pain is there, or repeated fever are there, then this can be signs of blood cancer. But again, these are not very, what you can say, hard and fast signs of blood cancer. Also, there are certain swellings we call lymph nodes, which can be appear on the neck, which can appear in the armpits or near the groin region. So all these signs can be of a blood cancer. But again, I will tell you that if I see all the patients with these signs, only 3 to 5% of the patients will be having a blood cancer. So if you are having any symptoms like weight loss is there, which is not planned, if you are having fever which is more than 7 days and just not responding, or bleeding from any side, definitely visit your family physicians or any other physician or doctor and get at least your simple blood test done, which called complete blood count, CBC. I think that is one of the most important tests. If you do, we can pick up the blood cancers.
ओके. सो जसे दोतोरान सांगला एकदम असो तुजो वेट देंवता, खूब वेट लॉस जाता, जोर येता कंटिन्यूअस मोर देन एका सुमाना वयर जोर जर येता, आनी बाकीचे खंयचे तुमकां थंय ब्लिडींग जाता किंवा आनी खंयची लक्षणां थंय तुमकां दिसता की नॉर्मल आसना, तेन्ना तुमी डॉक्टरा कडेन वचून तुमची तपासून मागीर डॉक्टर फुडलें सांगतलो. Okay. Now the second part of her question was most of the times people get operated for cataract when they cannot see, but is there something like cancer of the eye is what she wanted to know.
Okay, so technically all body parts can get cancer. Basically cancer is not something alien, means it is not coming from outside, it is just uncontrolled growth of all these cells. So that is the most important thing. So there are certain tumors are seen in the eyes, especially a tumor called retinoblastoma, but usually that is seen in a very young age, that is seen in childhood, which is usually we say less than 5 or 7 years of age. We hardly ever see about 10 years of age. And other cancers also can go to the eyes, but it is very rare, means it is not even, I will say, 1 in 1000 to get eye cancer. It is very rare, but usually in the old ages we do not see cancer in the eyes.
जशें तुवें विचारला, कॅन्सर दोळ्यांनी जावं शकता, पूण ताजे खूब कमी प्रकार आसता आनी ल्हान वयान जाता, म्हातारपणान जायना. चडशे कॅटरॅक्ट आसता, पूण म्हातारपणान दोळ्याचो कॅन्सर अशें आमकां चड दिसना. Doctor, we had this question about the polyp in the gallbladder. So that patient has also said that he is a type 1 diabetes patient from the last 9 years and it's under control. Does that have anything to do with his polyp?
Yes, so that is what I'm not about polyp at least, but gallstones. So that's the reason why I said some time back कि whenever you are having a gallbladder problem, so almost if your age is more than 40, almost 30 to 40% chance is there that you might suffer from gallstones. And when we are saying say diabetes, so if he's saying is a type 1 diabetes means he takes insulin regularly. So there are a lot of other metabolic abnormalities we see, means they can also have high cholesterol or high triglycerides, and all these things when your lipid profile is also deranged, they can constitute all these gallstones, and you have a trouble. Again, gallbladder polyp, again all polyps are not cancerous. Only thing which I have said some time back, that if you are having having pain which is repeatedly requiring a doctor's attention, if you are having a significant weight loss, or you are having a loss of appetite, then all these symptoms if you are there, definitely see a surgeon and get evaluated.
Right. She further goes on to ask the same patient that I want to go in for a pregnancy, so do you think it would be any problem?
No, usually it is not a problem. In this gallbladder polyp and other things, they are not really going to have maybe if there is a tendency to have a dyspepsia, or common term what we call acidity, then you might have that, but usually that shouldn't affect your pregnancy.
Right. I think I have answered that question of hers. The next patient, we have a question. Ovary is significant of malignant tumor. Please suggest the treatment.
I didn't get the question.
It's an ovarian tumor that he's asking about.
Yeah. So the thing is that usually ovarian tumor, the primary treatment is surgery. So whenever we see ovarian, any tumor in the ovary, especially if we are seeing in the young patients, say less than 35 or 40 years of age, that time the ovarian tumors being cancerous are very less, but still we look at the family history and other history, and then there we usually what we do the biopsy, because that is the time when we wanted to preserve also fertility, that is a childbearing age group. So they wanted to have further children or anything, we have to really assess into it. But the same comes after menopause. And then we are saying like ovarian cyst, it is very rare to see a normal cyst in the after menopause. So there we definitely evaluate them. And in ovarian tumor, if it is operable, usually we take out the tumor, and if the diagnosis was made before the surgery with some biopsy or some other reports, then definitely we do a proper cancer surgery at the first go only. If sometimes what happens that you are not aware when you are doing a surgery there is a cancer, so we do something called frozen section during the surgery. There we diagnose the cancer during the surgery, and if it is cancerous, then we extend the surgery and complete the surgery. So that is the most important thing. And then based on whatever comes in the pathology report of that tumor, then we take a call what needs to be done further in that patient.
Right. So doctor, as I was asking you before, what role does smoking and tobacco chewing have in cancer? Because most of the times we see that patients who have never smoked and never eaten tobacco have cancer, and those who smoke and and eat tobacco never have cancer. So you have both sets of patients.
So basically even many of the patients also ask me that they have seen their ancestors smoking all their life and daily lived more than 90 years 80 years without any cancer. So I just wanted to tell you a simple thing, that smoking and tobacco is the highest association with the cancer, and not just lung cancer or oral cancer, but there are many other parts. You can have a bladder cancer, you have a kidney cancer or stomach cancer. So all these cancer can be associated with smoking, tobacco, alcohol. So definitely I will tell you that almost those who are if I am seeing a cancer patient, almost 50% of them are because of some sort of bad habits in India. So that is one of the most important thing. And to tell you that I always give the simple example, a good driver and a bad driver. If you are a bad driver, you are not following any traffic rules, definitely your chances to meet with an accident are very high. If you are good drivers, you are following the rules, still you can meet with an accident, but chances will be very less. So it is the same simile for the smoking or the tobacco or the alcohol. If you are having these bad habits, your chances of getting a cancer are almost 15 to 20 times higher than the normal population. So definitely you should stay away from all these bad habits.
Right. Doctor, there's another myth also that says that when you consume white sugar, it can lead to cancer or it's cancerous. Is that true?
So many of my patients also ask me that if we eat sugar, that will feed the cancer cells and my cancer will worsen, so shall I avoid the white sugar or something like that? So see, the sugar is bad in not bad in absolutely all sense. What is the most important thing I just wanted to highlight is the refined sugars, which you will see in artificial sweeteners. You have colas and other drinks which they're very high with sugars and preserved foods. So avoid as much as these refined sugars. Definitely we require some sort sort of sugars in our body, because if somebody faints on the road, what we give, we give some sharbat or something like that which contains sugar, with the premise that they might have dropped their sugar. So sugars are definitely essential for our body. In fact, all the elements, so it's about carbohydrates, proteins, and the fats. So carbohydrates, sugar mainly comes from the carbohydrates. So what is the bad is, it's a preserved sugars or refined sugars which are bad, and they are not just bad in the terms of, I'm saying, cancer, but it will also leads to obesity, diabetes in the long run. And I think they are more dangerous diseases even compared to cancer, because cancer incidence is very less, while India is slowly becoming a diabetes capital.
Right. Doctor, in your practice, what do you think is the incidence of cancer in Goa, and what are the most common types of cancers you find?
Okay, so Goa, if we really look into the terms of, see, the thing is that cancers also, they're different in the, what we can say, a developed world and a developing world, or what I just wanted to say, it depends upon the socioeconomic strata, how developed we are we a urban or rural population. So Goa is more of a developed state, and what you can say, more of a city, urban kind of population is there. So definitely the commonest cancer which we come here is in females. We definitely come across the breast cancer and ovarian cancer, while in the males, surprisingly, we have a lot of colon cancer in Goa, then the stomach cancer what we see, while the commonly seen in India, head and neck cancer, which is very rare in Goa, I mean less in number as compared to the other cancers. So if I have to give a roughly incidence, Goa, if we have done some census just 2 years back, almost every year, almost 1200 to 1500 new cancer patients are diagnosed in Goa.
Right. Well, doctor, we have a question that has come, and it says that does not breastfeeding your child and conceiving later on in life lead to higher chances of developing cancer?
Yes, sir. I mean, that is partly true. Again, there is no direct correlation, but what we usually find, that nulliparous status means those females who do not had children or have not breastfed their kids, definitely they have a higher chances of getting a breast cancer. Definitely, again, all these late pregnancies which are there and other things which are again developed, definitely are associated with cancer. Again, we do not have like direct correlation, but it is like they all have propensity to develop a cancer, and we call all these factors as second hit. Means you have some propensity baseline, and on the top of it, all these factors also there. So many of the patients are undergoing treatment for infertility also. So I'll give a simple example. When I was a student, way back in 1996, 2000. So that time, we used to call elderly primary means 30 years of age, So those females who are having a pregnancy for more than 30 years used to be considered high risk. But now with the present era, most of the females are having pregnancy somewhere between 30 to 35. So now we are saying it's a elderly primary is 35 years. So the thing is that we will change our rules, but the biology never changes.
Yes.
So biology is going to remain the same. So definitely all these definitely play a risk factor in the development of cancer.
Right. Doctor, in the treatment of cancer, sometimes a lot of home remedies also are used, like boiling of tender coconut water, or eating kiwi or dragon fruit, or like the locally grown palponos that we have in Goa. What are your thoughts on this?
So thing is that the thing is all these are ancillary treatment. Definitely this was a very hoax message, which was actually doing rounds on the WhatsApp, that that the director Tata has said that boiling the coconut water is one of the good remedy, and I think absolutely it was hoax. He also has issued that later. So whatever we read on the social media or with the internet, everything may not be true. So definitely consult your doctor. Having these fruits like the kiwi, like people also ask me dragon fruit and other things. Definitely these are all are good fruits, but definitely if you are looking in the terms that they will cure cancer, they will increase your immunity, is not like that. Usually what we recommend for all our patients, whatever the local fruits or local medicines there, they are suitable for that environment, that climate, everything. So always consume local fruits. So we have like mango, we have banana here. So all these fruits are the coconut. So all these things are definitely healthier options, but there should not be excess. Sometimes when I ask the patient, they are almost every time having fruits only and not having a normal diet. That is also not right. So what I wanted to emphasize, everything is good definitely, but it should not be looked in the medicinal manner. It should be a part of your diet, or it should be part of your healthy lifestyle.
Right. Doctor, we have a question. My wife had a left breast wide excision surgery done in April 22, that is this year only. It was non-cancerous. Now she complains of pain and hardness at the surgery site. Is it normal, and should she take any medications for the same?
Again, it's more of a personal question, which unless we have examined the patient, it's very difficult to say.
Right.
But yes, whenever you have any major surgery, if there was some sutures, definitely that area while wound healing will cause some sort of pain. Sometimes
be
excessive
tender as well.
sensations are there and can cause some sort of hardening. But definitely, if that is there, we can get simple tests done like sonomammography, where if the breast is painful, we just use a simple sonography to screen the breast, or other things are there. Definitely without examination it will be very difficult, but yes, post surgery you can see all these changes. If what we usually say, that if there is any lump, if any swelling is palpable, of any skin changes are there, or any discharge from the nipple is there, or any puckering what we say, or breast is looking asymmetrical, then definitely you should see a surgeon at the earliest possible.
Right. Doctor, as soon as cancer is diagnosed, I think the patient is always recommended for chemotherapy or maybe radiation, but always the patient prefers and always asks about alternative treatments for the cancer. So what do you think, alternative treatments are better than conventional treatments for cancer?
So it's very difficult question. Definitely I don't have any mastery on these alternative therapies, so very difficult to say whether they are useful or not. But as per my experience which goes, usually we say that do not go for these alternative therapies. In India, if I have to really give a statistics, almost 70% of the patients, they come in very advanced stages, stage 3, 4, where it is very difficult to cure, or very have a dismal cure rate. So that is one of the most important fact I just wanted to highlight. What usually I say, whenever you are getting treated by any of the pathy, definitely you should remain honest, or you should be continuing that pathy regularly. But as of now, when we are speaking in the terms of the cancer and other things, definitely the modern medicines has answers for it. Yes, the cure rates are evolving over a period of time. If I have to really give an example, that there is a blood cancer called ALL, when it was 1940 to 1950, when it was like 100% death rate. Today at this era, in children, if it is happening, it is almost 100% cure rates are there. So what I just wanted to highlight here is that science is ever evolving, it is going further. So unless you have any proof, because many of the times what happens, there's some false promises are made. Sometimes what people will say, there are less side effects and no like conventional chemotherapy will, or any other side effects are there, so we can avoid that. But definitely there are no shortcuts to the success. That is the only thing which I can tell you right now.
Right. Doctor, we have another question that says, what are the warning signs of any cancer?
Okay, so it is very broad question, because I said that you can have practically cancer of any part of the body. So what you usually say, if we'll start from the head simply, and if somebody is having a headache for more than say 14-15 days, which is not getting relieved, and there is no apparent cause like blood pressure or any vision problem are there, if you are having any visual changes, you are seeing a double vision is there, or if you are having any swelling in the mouth, or any ulcer in the mouth which is more than 7 to 10 days, which is just not going, any swelling or any what you can say lymph nodes or any part of the body is there, if you are noticing a bleeding from the nose which is without any cause, bleeding from the gums is there, bleeding in the stools is there, your bowel habits, means passing motions, the habits have changed for more than a month, where there is intermittently loose motions or constipation is happening, you are having any pain, abdominal pain for more than say 14-15 days, which is not relieved by medications and even after evaluation, cough more than say 2 weeks, and any weight loss, I said as that which is more than 10% of your body weight, and it was not planned weight loss, means you are not dieting, you are not consciously having doing any effort to achieve that weight loss. So any of these symptoms are there, definitely this can be. But again I will say these are not very hard and fast what can signs and symptoms of cancer, but if you are having any of this, definitely you should meet your family physician and you should get evaluated.
Right. Doctor, we have another question. What is chemotherapy and radiation, and is there any new type of cure for cancer available with the advancement of science?
Yeah, so definitely chemotherapy, radiation is where we use rays. Definitely we use photons, basically these are the x-rays, and there is another therapy newer is called proton. So all these are basically we use these radiation beams to target a cancer. Usually it is mainstay in the head and neck cancers, in some sorts of brain tumors. So it is one of the mainstay of the treatment. It is there. Definitely it is also given in the breast cancers and other tumors where it is indicated. While chemotherapy is the use of drugs basically, so all these drugs, they are called cytotoxic drugs. So these drugs, they basically work on the principle that whatever is growing inside of the body, just go and kill it. So tumors are constantly growing, and that is the reason why they get targeted by these drugs. But the other problem which happens is that our hair are constantly growing. So that is the reason why we see hair loss, our nails become blackened, our skin becomes blackened. But now with the advent of newer drugs, all these chemotherapy side effects are slowly regressing. So now, as they have asked, yes, now there are newer therapies which we call as a targeted therapy or immunotherapy. Now to give a simple example, a targeted therapy means you know what is a cancer cells properties are there, and we are using a very specific drugs. So it is a tailor-made therapy for each patient. So each patient will have a different therapy, and they will not be having the same therapy as other patient may be having the same cancer. So we study the properties of the cancer and accordingly we target. And there is a newer therapy called immunotherapy. It has a potential to control even in the advanced stage or stage 4 cancer also. Currently, it is one of the most active treatment in the lung cancers, in the melanoma, which is a type of a skin cancer, a renal cell carcinoma, which is a kidney cancer, Hodgkin's lymphoma is a blood cancer, and also now it is coming in head and neck cancers and whole other lot of cancers. But all these newer therapies definitely are expensive. Over the period of time, they are getting cheaper and more accessible to the patients.
Right. Doctor, we have another question that says, does regular use of makeup and sunscreen help in preventing skin cancers?
So, but the skin cancers are as such very rare in India. To be give example, skin cancers are more common towards the polar region, where what we say direct UV rays of the skin, sun are directly in, and that is usually seen, near Australia or New Zealand or here in Norway, Sweden, all these countries, where what we say there is ozone holes are there, and the UVB sun rays, they can directly penetrate and can have a skin cancer. In India, definitely the incidence of skin cancer is very less, except if somebody is having any chronic wound, or means the wound is more than say 6 months, 7 months, which is just not healing, or some scars are there. So there they can develop a cancer. But yes, if you are using a good sun protection factor, I will not say makeup, but if you are using a good sunscreen protection, so what usually we say SPF of more than 30 plus, if you are using it, definitely they prevent cancers which can be caused because of the sun UV rays. But whenever you are using these sunscreens, remember that if you are having a much more sweating, you will have to replace the cream maybe every 3 to 4 hours.
Yeah, and if you're outdoors for that much amount of time. Right. So as you were talking about chemotherapy, Dr. Ashay, chemotherapy, many times people think that chemotherapy causes the spread of cancer, or it makes the patient weaker, or it causes some burning sensation in the body. What are your thoughts on this?
Yeah, I mean, there's definitely when I'm seeing, this 15 years I'm in this field, and when I see there's a paradigm shift. When I was a student, almost 50 to 60% of the patients, they used to require admission for their treatment. Now with the advent of newer therapies and newer supportive care, hardly 5 to 10% of the patients they require admission, while 90% of the patients they complete their treatment on daycare basis or what we call OPD basis, where do not even need to stay inside the hospital. Even there are newer therapies which have come, which has really less side effects. There are newer technologies have come where what we call is a scalp cooling, where we apply some cooling machine through the head during chemotherapy administration, and we can even reduce the hair loss, maybe completely in certain situations or at least partially. So all these treatment have come up or evolved over a period of time, and definitely having a less side effects. So do not really worry about these side effects. Definitely these are very less in the current era.
Right. Doctor, do you think food habits has a role to play with cancer? Does the food we consume makes us more pre-reclined to developing cancers?
Yes, so definitely, I mean, the food is one of the most important factor, just not in terms of cancer, but even the other disorders also. So as we said, the less of sugar, less refined, less oil. So one of the most important factor the cancer is obesity. So obese person, they have more chances of getting a cancer as compared to a normal lean individual. So definitely the food really plays an important role. And again, most important factor is that at least we should have at least one fresh fruit a day, or one salad a day, fresh veggies which are not cooked, and should have less refined sugars, less preserved food. So do not have high content of preserved foods, or where artificial colors are used, or artificial other chemicals are being used. So have less of these processed foods, and as fresh as possible the food if you are including in your diet. definitely that is much more healthy lifestyle to adopt.
Right. So, doctor, we have another question that says, even with modern treatment, are cancers completely curable? Can the person go back to his or her normal life?
Yeah, so definitely. So the thing is that the answer to this question is not that simple. It always depends on at what stage the cancer was diagnosed. And I will give a simple example. When we are treating a breast cancer, again it has gone so many evolution over the period of time. Set stage 0 cancer, which is usually detected by if somebody is doing really mammography regularly or cell press examination, their cure rate is 100%. Well, stage 1 is 95%, and somebody in stage 2, the tumor has more than 2 centimeters, it drops to 70%. So see, there is a difference when at what stage we are diagnosing. Yes, with modern treatment, many of the cancers which were previously considered non-curable are curable, and definitely people are leading now a normal life. So that is another thing. Now we are looking at what we call as a cancer survivorship. So any cancer when we treat, first 5 years we say that cancer is in control, but more than 5 years we say the cancer is cured. Now we have to really look into the problems that all these cancer patients, when they are surviving long term, whether they should have a normal life, because there are various other side effects of the cancer treatment can be there in the long term. So definitely with modern treatments, the cancer cure rates are increasing, and now actually we are having a specialized clinic called cancer survivorship, where all these patients who are surviving long term, we ensure that they are leading a normal life.
Right. So, doctor, in all cancer cases, do you use radiation as a mode of treatment? Because most of the times patients think radiation means burning that particular part of the body.
Yeah. So radiation is basically practically use of, I said, is a high energy rays are there for photons, or now they're protons what we are using. So definitely it's not burning or anything. Like people have really they fear. Now which part we are using radiation, because the highest side effects what we say is in the head and neck region. Because when somebody is receiving radiation to the face or other things, where they develop lot of ulcers. While at the other part it is not so much. And now with the advent of newer therapy called IMRT or IGRT, what we say, image guided therapy, now all these side effects they have reduced minimally. So definitely with the newer technique, now also there is a technique called proton, which is available as of now only in Chennai. So this therapy again has reduced side effect, but yes, definitely is much more expensive as compared to the normal radiation. But what I just wanted to highlight here is that now with newer modalities and newer technologies, even the radiation has become less harmful.
Right. Doctor, we have a question that says, I consume local rock salt available. Will it help me to prevent thyroid cancers?
So definitely thyroid cancer, again, so the local rock salt, whenever you see, if you see a lot of advertisement that it is a iodized salt, it is one of the most important factor whenever we see iodine, basically lack of iodine, if it is there, usually it will lead to something called as hypothyroidism or, goiter, basically swelling in the thyroid. But again, using like rock salt or other things, definitely there is no clear-cut indication or evidence to show that it reduces the cancer. But I think everyone should have their good habits, whatever they are continuing. But this is not like a specific indication to prevent thyroid cancer.
Right. Doctor, we have another question that says, what should be the diet of a cancer patient?
Okay.
I think that depends on what type of cancer the patient has.
See, the thing is that whenever any cancer patient is there, we just do not, I always not look at it as just only cancer patient. We always look at the baseline, what other problems they are having, like if they are having a diabetes, whether they are having a blood pressure problem, or they are having a cholesterol problem, and all other things also taken into consideration. So for the cancer patients, if we usually tell them that whatever the other problems you are having, you should also take care of that diet also. It is not that you're supposed to look at the cancer diet only. Usually what we tell our patient, they should have frequent meals, at least every 2 hours, at least small meals. So they should have 6 to 7 meals a day, small quantity. At least have one fresh fruit a day or fresh salad. Definitely it should be washed thoroughly and clean. Usually have fruits with the thick skin, where you peel off the skin and you have the fruit. That is one of the best strategy to have. Freshly cooked food, food is cooked and kept in the fridge for 2-3 days. It is not right to consume that kind of food. At least fresh food, and it should be prepared hygienically. That is one of the most important thing. And again, avoid preserved foods or avoid processed foods, and as well as outside stuff, because the thing is that how much hygiene has been taken during that preparing of that food cannot be ascertained. And I think that is the most important thing we should be taking care. Otherwise, there is no specific like cancer diet. You will hear a lot of things that they shouldn't eat sugar, they should not have milk or something like that. It is not really like that. Everything in the balance. And I think because in the cancer patients, they actually have a low appetite because of all these things. They have loss of taste. So usually we tell them not to have too much of food fats, eat a balanced diet, hygienic and freshly cooked diet.
Right. Doctor, we have another question on social media. It says, I am a CML patient and now since 15 days I am getting bad back and neck pain.
Okay.
Has this got something to do with the spine treatment?
But I mean, they have already underwent. See, so chronic myeloid leukemia is very simple, though it is classified like a blood cancer, now it is more to be treated like a blood pressure diabetes, where simple oral tablets just take care of it. Definitely. So usually somebody on the tablets. So there are certain, if you are on like a tablet called imatinib, again it has a side effect of sometimes having a muscle pain or back pain or leg pain. But for how much period you are taking, again it is very difficult to say. So if you are having all these back pain or leg pain, the simple test you should be getting done is your complete blood count. If that is normal, then definitely you should see your orthopedic surgeon. But again, all these recommendations without seeing the patient is very difficult to say, but at least this is the basic thing should be done.
Right. Doctor, there's another question that says, is liver cancer hereditary, and does regular consumption of alcohol lead to liver cancer?
Okay, so liver cancer is very rarely hereditary. It's not usually the commonest cause which we see in the liver cancer is viral infection, hepatitis B, hepatitis C, which causes something called as a cirrhosis of liver, where liver absolutely get destroyed, and over the period of say 15-20 years, these people are likely to develop a liver cancer. Again, it is usually not hereditary. Alcohol, yes, alcohol has one of the etiology to cause a liver cancer, just not liver cancer, but again you can have oral cancer, esophageal cancer, stomach cancer, kidney cancer, bladder cancer. So all these cancers can be caused because of alcohol. So definitely I will not say consumption in moderation, because many of the time people argue with me that wine is good for heart, a small quantity of alcohol is good. There are n number of things which are good for heart and other things. So definitely, but again, if you are consuming, you should be consumption in moderation. Again, definitely is no definition of moderation, but should be cut down to minimum, because all these habits at the end of the day are bad and they can lead to cancer.
Right. Doctor, we have another question where a patient says that he had cancer of the kidney where he underwent nephrectomy. He wants to ask us whether he will develop cancer in the other kidney as well, which is as of now healthy.
Okay, so the thing is that the kidney cancers, when they are hereditary or if there is some genetic cause is there, usually they can be bilateral. Otherwise, it is usually seen in the single kidney. Very rarely you see the cancer in the other kidney. So only solution to it, what we say, surveillance, means they should have regular visits to their treating doctors. Usually for first 5 years, we at least tell them to meet the doctors at least once in 3 to 4 months. And once more than 5 years are completed, at least we say them at least once in 6 months or once a year, you should meet your treating physician. Again, definitely we do not see the cancer again in the kidney, but other problem what we usually look at, in 20 to 30% of the patients, that the other kidney can have the reduced function over the period of time. So all these patients, we usually recommend that do not take any medications without any supervision of the doctor, because these medicines can be kidney damaging or what we call as a nephrotoxic, and they should have healthy habits, because they are living with like a single kidney, so they should be taking utmost care of that other kidney.
Right. Doctor, most of the time cancer patients, are isolated in the house. They are, told to sleep separately, eat separately. Children are not allowed to be with them. What would you advise on this?
Yeah, so this is one of the most important problem when we see, I can treat the patient, but what I see that the best outcome I get when the patient have really good social support or the friend support, and isolating this patient is one of the most difficult problem, because cancer patients, even though they are not treatment, they are not harmful to anybody. I get a frequent questions that we are having a small kids at home, shall we allow them to go to near the patients or not? Cancer patients, if you treat them, if you care for them, they are not going to cause you any trouble. in fact they can get troubled, because if somebody is having say fever or some infection, then cancer patients can catch easily those infections.
Because
So
they're
cancer patients need not be isolated, they should get mixed up with all the people. Only thing we always tell cancer patients to avoid crowded places, when they are on treatment, like marriage or some gatherings are there, and not to eat at those places, because maintaining the hygiene while preparing the food is very difficult on those sites, but they do not require any sorts of isolation.
Right. Doctor, we have another question where a lady asks us, how often do we have to do mammography and at what age should we start doing it?
Okay, so very good question. Basically, it is just not about mammography. Like in country like India, where population is very high, to just give you a simple statistics, we have almost 12.8% of developing a breast cancer in the females. What it means that out of every 8 female, 1 female is going to get a breast cancer in their lifetime. So we should be what you can say very vigilant about it. So what we usually say, after age of 20, you should have self-raise examination done every month and at least once a year by the physician. So you can go to the YouTube and you can see how to do self-raise examination. It is very easy. It is in the front of mirror while you are lying down or while taking a bath. There are certain changes what we say. If you see any lump or any swelling or any skin changes, any discharge from the nipple, you should see the physician. First mammography, what we say, should be done between age of 35 to 40. So again, this what you can say, the recommendations vary if somebody is having hereditary cancer, but at least after between 35 to 40 we should have first mammography, and then we say at least continue with the self-raise examination, and you can get a mammography done at least a year or alternate year till age of 65.
Right. So that was with regards to females. Do males have to do any investigations, that would give certain pointers towards cancer that is more predominant in males?
So very good question, Dr. Stacy. So the thing is that in the females we usually recommend only 2 cancer screening. The first is the breast cancer, for which I told you how to go about it, while the pap smear should be done after marriage. At least if you are doing it on consecutive 3 years, it is normal, then we suggest once in 3 years till age of 65, and there are certain ancillary tests we do. In the males as such, we do not recommend any screening test. Like many of the people, they come to us, how to get a screening done or anything. While in the males, we do not have like any common cancers which can be easily detectable. So only things, if the patient are chronic smoker and they are willing to stop smoking, then we do their screening for the lung cancer for consecutive 3 years with simple CT scan. But again, those kind of recommendations are usually Western and not Indian population based, but that is the only screening. And in those patients, if they are having a very high risk of prostate cancer, means in their family more than 2 or 3 prostate cancer patients were their blood relation, or any prostate cancer who was less than 50-55, in those, and lymphoma. Again, as I told before, that blood cancers, the commonest sign what we will see will be easy symptoms which you are having.
Right. On the same lines, do you think that blood cancers are predominant in a particular age group? Because we see children also with, blood cancers. We see, the older generation as well.
Yeah. So thing is that even cancers, we see there certain cancer are commoner in some age group. Like what we say, ALL or acute lymphoblastic leukemia, that is cancer is more common in the childhood, or some called is Burkitt's lymphoma, again is very common in the childhood. While there are certain cancers like other lymphomas or acute myeloid leukemia, they are common in the middle age population. Again, there are certain lymphomas we say called follicular lymphomas, they are seen only in elderlies most of the times. So usually they will have some sort of patterns are there, but blood cancer are usually seen right from the childhood to the adulthood. Yes, cancers can vary, there are different types of cancers are there. So definitely there is no predilection, and to give a fact and figure, the blood cancer, they constitute almost 2 to 3% of all cancers put together. So it is very rare as when we are seeing in the terms of oncology committee, as an oncology community, what we are looking at this cancer, but definitely you should look for other signs.
Right. Doctor, we have another question that says, what precautions are taken if somebody has a very bad hereditary history of cancer?
Hello.
Right.
So the thing is that what are the hereditary cancer that we should understand first? So hereditary cancer,
Breast
if we are-
cancer.
yeah. So the cancers which are like breast cancer, ovary cancer, or colon cancer, if you are saying more than 2 or 3 people affected on the same side, so they are blood related, like sisters, the maternal aunt or paternal aunt, cousins, if they are affected, if any cancer cases are less than seen in less than 40 years of age, so all these patients, they can potentially have a hereditary cancer. So what usually we tell that those people who have got a cancer, they should get tested first, and if you find some genetic change, then other normal relatives also should get checked for that genetic change only. If that genetic change is there, I will give a simple example now, because of the lot of people we have access to the internet, general knowledge, there is certain gene called BRCA. Now this gene is associated with the breast cancer and ovarian cancer. The common example is always I give is Angelina Jolie, who is a Hollywood actress. If you have seen her, that she has underwent bilateral mastectomy, means she has got her both the breasts removed and she had to put an implant. Why? Because she had that BRCA gene which makes her prone to have a breast cancer. Now we have two options. Either we can do like these prophylactic surgeries where we remove the part which can cause a cancer, or undergo regular surveillance. As I said, normal people should have mammography once in 2 years. Well, in this we do mammography at least once in 6 months, routine X-ray mammography and MR mammography alternately. So whenever we suspect hereditary cancer, definitely the surveillance pattern is different as compared to the normal population, but with this simple surveillance we can take care of it.
Right. Doctor, does cancer treatment lead to infertility? This was the last question I'm taking for today.
Yeah, so basically in cancer treatment, previously we used to see a lot of infertility, especially when we are using very high intense chemotherapy in certain sorts of blood cancer, or when we are doing a bone marrow transplant, or ovary directed treatments which are there. But now there are various technologies which are there where we assess the patient's chance of getting infertility. So there are certain injections are available where we make ovaries quiescent, and so that the therapy can be given, and again once the therapy is over, we stop these injections. Again we can preserve the ovum in the females, or even preserve the embryos especially in the married couples. For the males we tell about semen preservations. But now with the advent of the newer therapy, the chances of infertility are really getting less. But yes, definitely we should discuss with all our patients that if the therapy has a potential to cause infertility, we definitely there are various methods which can be successfully used to preserve the fertility.
Right. So, doctor, as we come towards the end of this program, what would you say would be your take-home message to our viewers on cancer?
Yeah. So definitely, what I just would like to tell you that yes, cancer was a deadly disease once upon a time, but now with the advent of modern treatment, many of the cancers are curable and people can go back to the normal life. The key to the cancer treatment is diagnosing early. So don't fear about the cancer. You have any abnormal symptoms, immediately meet the expert doctor and take treatment on time. Do not fear the treatment. All these newer chemotherapies, targeted therapies, immunotherapies or radiation, they have a less side effects as compared to the conventional chemotherapy. Definitely prevention is one of the best answer. Means you have to prevent the disease. So in India, 50% of the cancers, they are lifestyle diseases or habit related. So stay away from the bad habits, avoid obesity, follow some sort of exercise regimen, have good food, that is at least fresh fruit in a, or salads in your diet, less of refined sugars, less of the preserved foods, follow some sort of exercise regimen, avoid gaining weight, avoid obesity, sleep well, do not take stress, follow certain hobbies, or you do some meditation. So all these healthy habits will definitely not only prevent a cancer but also blood pressure. They will also prevent diabetes, obesity and all other related problems. So healthy lifestyle is again a key, just not to prevent a cancer but also other disorders also. But if somebody gets stuck with the cancer, definitely there are newer treatments are available. So should see a doctor on time and do not go behind any unscientific form of treatment just to think that they might have a less side effects, because again I said there are no shortcut to the success, and with newer treatment we can cure more and more patients. And especially if you are not stuck with the cancer but somebody has stuck with the cancer, at least try to take care of them. Do not isolate them, because cancer is sometimes like social stigma where people wanted to hide from their relatives, other things, because that also have a social impact. So at least you should have sympathy towards this patient, because this patient also needs love and care. I think that is the take-home message from my side.
Right. Doctor, thank you so much for, taking your time from your very, very busy schedule. I think you are always traveling around and, spending so much time with us, answering all our questions and giving us such valuable information about cancer. इश्टानो फुडल्या सप्तकाक म्हजे वांगडा आसतलो हाडाचो तज्ञ दोतोर डॉक्टर रोहन देसाई. तो ह्या विशयाचे तुमचे सगळे प्रश्न तयार दवरात. तो म्हणसर पळत रावा प्रुडंट. काळजी घेयात आनी मोग आसूं.